A colleague reached out to me and said that she has clients that are being referred to pelvic physical therapy by their providers or doctors, and they really don't know what's going to go on at a physical therapy evaluation, what are appointments like when you go see a pelvic physical therapist. So I thought, how fun to talk about what it is that we do. So pelvic physical therapists, first and foremost, are physical therapists. We have been to physical therapy school and we learn how to evaluate and treat the musculoskeletal and neurological systems, among others, to improve function. That is our main goal. So we have learned about shoulders and backs and knees and hips and all those kind of things. But we receive in-depth specialized training to be able to know more about this part of the body. In school, we either don't learn about it or we learn about just the tip of the iceberg. So we have to get advanced training to be able to work with this. So now, going back to just the idea of physical therapy, most people think when they go think of physical therapy that they're gonna be in a big open gym, there's gonna be exercise equipment and people in shorts and people doing squats and getting their shoulders worked on, all those things. So your pelvic physical therapist may work in an environment like that. They may work in a hospital, they may work in a yoga studio, but they're gonna have some kind of private treatment space to be able to evaluate and treat this part of the body. That is probably gonna have a lot of the same things that you imagine in physical therapy. A nice big treatment table, foam rollers, TheraBands. We're gonna have a lot of specialized equipment too. Things like pelvic models, both male and female, because everybody has a pelvis, right? So what's gonna happen is you are gonna receive some paperwork that's gonna ask you about some things that you probably haven't been asked by other physical therapists. Things about bowel, bladder, sexual function, because we're gonna try to get some of that information before you walk in the door. Then when you come in for your appointment, we're gonna be talking a lot. We're gonna be asking you about how is poop, pee, sexual function, what's your birth history, what's your surgical history, what is the thing that you're having trouble with, and we're gonna ask you some really in-depth information about that. I oftentimes have patients say, you know, I wouldn't have told someone else about this, or, you know, their third and fourth visit, they may tell me something that they weren't quite comfortable telling me on the first visit. We really want this information. It helps us to treat you better, to get as much information so we know what it is that, the most information about what it is that we're trying to work on. So we're not embarrassed to talk about it. I know it's not always easy, but just know that we have a safe space to be able to work on these things. After that, we're gonna do an examination. We don't just look at this part of the body. We're gonna look at kind of everything from your shoulders to your knees. And to be fair, I also look at people's feet, I also look at people's neck and how it influences part of the body, but we're gonna look especially at things like your abdomen. What is your stability? What do your ribs look like? How is your low back? How does your hips function? Before we look at anything else. Now, pelvic physical therapists at some point typically will do an external and possibly an internal pelvic floor muscle assessment, okay? So this is not like going to the gynecologist or the urologist. We are not looking at the same things they are. There are no stirrups on our treatment tables. We're not using speculums because we're not looking at those things. What we want to see is how this part of the body is working, right? We can't, by looking at someone and standing, tell what's going on with their pelvic floor muscles. That's not really possible. We can get some ideas, but we can't actually accurately assess that. So these muscles too are just like any other muscles in the body. They are super special, but they can have all the same problems. They can be tight or get knots in them like you may get in your neck or your back. They can be weak, they can be strong. Tight, loose, coordinated, incoordinated, turning on and off the way they should or not. So we want to get all that information so we can actually help the problem that is that you have going on. So that involves palpating the area to look for some of those trigger points to see how that muscles are doing. We're gonna look at this part of the body, and then again, we may do an internal assessment. And by that I mean we are going to insert our finger into the vaginal or the rectal canal so we can assess how those muscles are functioning, if they're painful, if you're using them in the way that you should to help this part of the body. Most of my patients that are aware they're gonna be having an internal assessment when they come in, of course, they have this idea like it's gonna be like going to the gynecologist. And then afterwards, they usually say, that was nothing, that was not at all what I thought it was gonna be, and it wasn't bad at all, right? The other thing people don't realize is when we do our training as pelvic physical therapists, we go and we learn how to do these evaluations and treatments. We practice on each other. And that can't be really said of most of the medical world, meaning everything I ever do to a patient, I've had done to me. And I've probably had it done by someone that was not nearly as skilled as I am, meaning we were learning on each other. So we know what it feels like, and we try to make things as effective and as comfortable as we possibly can, okay? Now, we are also, during that evaluation, we're gonna be performing some treatment, just like another physical therapist would. That may involve working on some muscle, fascia, or other tissue. That may involve behavioral changes. That may involve posture or exercise. But you will leave your appointment having something that it is that you're gonna be working on to help address that problem. We may also be sending you home with some diaries, a little bit more information. Most of us, we don't really pay attention to how much we go to the bathroom or how much possibly we leak or what happens when we have bowel movements, right? So we may send you home to get a little bit more information, again, so we can fine tune and hone what this is. So I have a feeling this is not going to be the only video that I do on what to expect from a pelvic physical therapy appointment. So if there's things that you want to know about, I would love to hear about it. So leave a comment here, go to my website, pelvicforward.com, or find me on Instagram and Facebook, both of those Pelvic Forward. So I hope this helps you feel a little bit better and more empowered about what's going to go on at your pelvic physical therapy appointment.